performing a glucose check. First thing I'm going to do is check the MAR, check what the physician has ordered. I'm going to verify my patient. As I walk into the room, I'm going to wash my hands and I'm going to don clean gloves. I'm going to check with my patient, identify who he is, his date of birth. Once I figure out my patient and that he needs a glucose check, I'm going to tell him to wash his hands thoroughly, clean them, get them dry, and then I'm going to start my glucose check. So right here I have my AccuCheck. I got all this, my monitor and my strips. So I'm going to get my strips and put it into the monitor. These don't fit, so I'm just going to act like it's in, and I'm going to turn it on, strip in, have that ready, and then I'm going to get my strip of alcohol, and I'm going to ask him, do you have a preference of where you want it? No? Okay, so I'm just going to do the lateral distal of his middle finger, and I'm going to clean. Okay, and I'm going to get my needle and click, and then I'm going to get a little bit of blood out, and I'm going to wipe that away, and then I'm going to squeeze a little bit more and get that second drop of blood, and then let it read. Okay, I'll put that down, cotton on. All right, and then it read 252. So I'm going to put all of this away, clean all this up, clean the monitor, and put it all away. And so it was 252, which means that the patient does have hyperglycemia. So I'm just going to explain that to the patient, tell him that his blood glucose was a little high and that we're going to need to give him insulin. And I also need to just kind of do assessment of him of those symptoms of hyperglycemia and see if he's experiencing any of those also.